to the Pledge of Allegiance.
Yes.
That actually did the work.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And thank you all for being here. If you wouldn't mind closing your eyes and bowing your head for the invocation. Heavenly Father, thank you for the food that was provided here for us. Please use it to nourish our mind, bodies, and souls to the betterment of your service. I also ask that you guide us and keep us on a path that's pleasing to you in tonight's meeting, and just watch over us and keep us safe tonight, Lord. In Jesus' name I pray. Amen. All right. And I believe we're at 4 now. So, looking over for approval of the minutes. Carla emailed us the minutes for our October meeting, and they're provided here for you in your packet. If you would look them over and see if there's anything that needs to be changed, or if there's a motion to approve. There's a motion to approve by Meg. Second by Missy. All those in favor, say aye. Aye. All those opposed? And the minutes for the October meeting are approved. And then next is the approval of the agenda for our division report. We have the grant application from the Delta Dental Foundation for Public Health, the Community Health Improvement Plan with Stephanie, the end of the year public health budget summary with Dennis, and the public health clinical service fees with Jackie. Is there a motion to approve the agenda? A motion from Missy as is.
Second.
Second by Meg Harkin. All those in favor, let it be known by saying aye. 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 All those opposed? And tonight's agenda passes. We'll move right into the division report with Dennis with the grant application from Delta Dental Foundation.
Thank you. Last year in January, we applied for our first opportunity for a Delta Dental Foundation grant of $5,000. The foundation provides this to various community service organizations providing dental services, and we are planning to apply for a second foundation grant, $5,000, basically just to continue what we've been doing. The funds for the Delta Dental Grant can go to support children and the service, dental care services in our county. Last year, or the current year that we're just finished with, we've been able to serve 32 children with those funds, and we're going to continue to do that with the funds this year. We anticipate at least serving probably 30, if not pushing 40 by the time it's all said and done. We may be able to serve some more children. Just so you're aware, our dental clinic, we have a sliding fee scale that slides to 60%, and we do take Medicaid, but we do occasionally have children that fall in the gaps, and sometimes they may not be able to get care because of the sliding fee being still prohibitive of getting care. So we use these resources to help assist them in getting the care that they need so that they can have good start to oral health, and we're just anticipating doing the same again this year for this application. This is more for information. I don't know that, if you wanted to vote in support of applying for this grant, that's fine. But it's more for information. We'll be taking this to the commissioners as well to apply for the funds. Happy to answer any questions.
And Dennis, you said it was just for kids.
Yes, it's just for kids. The focus is on children.
How many patients does it typically cover, a 5,000 grant?
We anticipate covering around 30. The funds we've got currently with the $5,000 has served 32 children.
And when the funds run out, the program comes to a stop?
Yes, it will end, and it'll just continue to be on a sliding fee scale. We do have some funds through an agreement addenda with the state for child health services that we can use some of those funds to help, but it's limited as well. So this helps us meet a need of children that may fall through the cracks for getting needed dental services.
And Dennis mentioned that this is just for review, but if the board would like to, we could make a motion in favor when they present it to the county commissioners. If anyone would be willing to make a motion. And I'll second that motion. Are there any questions or anything before we vote? All those in favor? Aye. All those opposed? And we will move into the Community Health Improvement Plan with Stephanie Starr.
All right. I think Megan's pulling it up. All right. I came here a few months ago with our community health assessment and provided information about that. So I wanted to follow up at this meeting with our community health improvement plan. So just as a background for this, just want to remind you that the community health improvement plan is developed for each priority area. So there's one for affordable housing, one for mental health, and one for substance use disorder. It's basically an action plan, and it's based on the results of the CHA, and it really defines a vision for the health of the community through a collaborative process, and should address the strengths, weaknesses, challenges, and opportunities that exist in the community to improve the health status of the community. So our Healthy Union Advisory Coalition, which a few of you actually sit on, work together on the CHIPs, and the CHIPs were actually submitted to the North Carolina Division of Public Health through new software that the state has purchased and we use called Clear Impact. And you'll see what they look like in a few minutes. I'll turn the slides, but I did want to explain things a little bit more. And so we submitted the CHIPs actually in September. So they have to be submitted within 6 months of doing the community health assessment or submitting that. So again, the North Carolina Division of Public Health actually has asked all local health departments to use a framework called results-based accountability. And basically, results-based accountability starts with an end that you want to see and works backwards. It's a step-by-step process, and it's something I've been trained in, and a lot of the other folks at local health departments have been trained on, and actually we have a few other staff here who were trained in this as well. And so basically for communities and counties, the ends are conditions of well-being or the quality of life that we want to see for our children, families, adults, or the community. They're aspirational statements. Think of them as vision statements pretty much. And in the system we call them results. And so for each of these areas up on the screen, we had to develop a result statement. And so for each result statement after that, the coalition looked at the data that exists that could measure and quantify the results. And those are called indicators. And the coalition looked at data that was accessible, local, quantifiable. We came up with a huge list of potential ways to measure the result that we came up with, but some of them aren't local and some of them are not measurable or really difficult to measure and obtain. So when you look at indicators, you definitely want to make sure that you can measure them pretty easily, or at least access the information pretty easily. So for each indicator, we talked about how Union County was going to measure how we were doing on the measures, so how we wish them to trend. So some you want to increase and some you want to decrease. And again, I'll show you what some of those look like in a minute. What factors, whether it be internal, external, environmental, political, that impact the measures, either in a positive or negative direction. So basically we kind of you do a root cause analysis, which is the best way I can describe when you're looking at each of the indicators and trying to figure out, what we have to look at there. So then for each indicator, we developed a list of partners in the community that have a role in making things better for each priority area. And they can include government entities, funders, businesses, educational organizations, community agencies, nonprofits, faith-based communities, and residents. Partners can be traditional, non-traditional. We just really tried to come up with as many partners that could help and assist with us moving toward achieving what we want to with the indicators. And following this, for each indicator, we came up with some strategies and ideas that might work to address each priority area. So some of the strategies could be evidence-based. Some are ones that we are currently doing in the community, and some are just ones that we came up with, ideas that we came up with. After that, we prioritized which strategies were feasible, valued by our community, and would have the greatest impact on the focus area at this time. So again, some are ones that we're currently doing. Some are done in the community by an organization, by a coalition. And then some of the ones we added on here are ones that the coalition wanted to see. And in this system, they're called programs. And they're put in the chip as well. And then for each program, there's a description of the program, what the program's about, how the program impacts the community, etc. And then the last component is performance measures. So that's how we measure the programs. And performance measures quantify how much we did, how well we did it, or is anyone better off. And so let me give you a visual because I think that'll help a little bit. I know this is a little small, and where the pluses are on here totally expand in this program, and where the little paper sign is next to it is where a lot of the details are behind this. So the results statement we came up with for affordable housing is that all people in Union County have access to safe, healthy, and affordable housing. Again, aspirational, but is something and a goal that we're shooting for. And some of the indicators that we put on here, and again, we looked at a lot of indicators, were the estimated hourly wage for renters in Union County, the number of homeless in Union County, the number of individuals seeking affordable housing in Union County, and the percent of cost burden renters and homeowners in Union County. And so just to let you know, and I didn't expand these so you can't see a picture of it. What's pretty cool is that we have data in here, and it is a document that we just add to and modify when we get the information, or I should say I do. I actually enter it on a quarterly basis, most on a quarterly basis, some of them on an annual basis, so it really depends upon the indicator and what data is out there. But you'll see charts and graphs, and I will send a link to this so you can actually open it up yourself and see it. It is pretty cool. So the program that we selected, so right now, there is no strategic plan in our county for affordable housing, at least not a comprehensive one. And we thought before, although we want that to be quote unquote a program and something that we're aiming toward, before that we felt like the community really needed to be educated on what the issues are. And so we're planning a housing symposium. Actually, our Thrive Union Coalition is actually developing this, where we hope to have speakers, and then we want to have officials, public officials, and those who are influencers in our community. There are a lot of things we could be doing in our community that we aren't. So therefore, we really felt like that would be the first step before we could actually even put more goals in here or more programs. In terms of what comes out of that. So really what we want to see coming out of this symposium is a committee that's going to really focus on that strategic planning for the affordable housing and addressing this issue. But again, before we did that, we felt like we needed to do a real good educational symposium. And that is going to be in February. I think it's February 9th. Don't quote me on that. I can get that date. I don't remember exactly, but I think it's sometime around then. But that is something. And again, the cool thing about this program is that it's not something stationary or static. We can continue to add programs in here as we go along. We could also decide that, you know what, this program, a program doesn't meet what we need to be doing. So it is a pretty neat program. In mental health, our goal was for all Union County residents to have equitable access to care and supportive services that promote resilience and mental wellness. And a couple of the few indicators up here are the total number of emergency department visits for 0 to 17-year-olds in Union County, and suicide rate in North Carolina per 100,000. I did forget to add that we are supposed to have at least one goal in here. That comes from the Healthy North Carolina 2030, so that's part of the state plan. So what I had asked them to do is actually get us, and I have the local data, but they wanted to be the ones to actually siphon out the local data on suicide rate. So that's something I'm still waiting for from the state folks to send to me. So that'll be added in here as well. Mental health is really interesting. We actually don't have a lot of local data that we collect here. I mean, there's emergency department visits for all ages, there's EMS calls, but besides that, there's really not a whole lot of data. And the reason I only focused on the 0 to 17-year-olds is because that has been the focus that we've been really looking at and working on. Yes?
For the emergency room visits for 0 to 17-year-olds, are they for mental health visits or
Yeah.
for all visits?
Yeah, no, they're mental health. These are all mental health related. And so, I forgot what I was just saying. Sorry about that.
Sorry.
No, it's okay. It doesn't take much to make that straight here. I'll think of it. We were focused on 0 to 17 because most of the services we have right now have been in that focus area. And it's not that we don't want to focus on the adults, but quite honestly, it's kind of interesting that the emergency department visits have actually started trending downward for those populations. But there seems to be real significant, more significant issues with the 0 to 17-year-old range. And under there, it's broken down by what they're in the emergency department for. So it's lumped into anxiety, depression, suicidal ideation, and a few other components. So that's below, in the data over here. So a few of the programs, I'm going to talk about the ones that we currently have in place that we've been tracking, because this was a goal. I think it was the same goal or result that we had in our last CHIP for our last community health assessment. So our Behavioral Health Collaborative, which Christina runs, you know, that is a program that we have at the schools, and so we've been tracking since 2019 or 20, I think 20, the number of students who receive services in the schools through the collaborative, and the number of presentations that her staff have done on social and emotional wellness for students, staff, and parents. One of the other, I'll come back to it, one of the other goals or programs we put in here is mental health awareness and community education. I collect that data, that some of that's what we are doing here, some of that is is what the hospitals might be doing, or you know, other community organizations. So that I contact places to collect this data. So this isn't health department only information. This is a community health improvement plan, and it's a community health assessment. So again, this isn't meant to oversee or look at just what we're doing here, but what the community sees as goals. And then mental health first aid and question, persuade, and respond. So we've been tracking mental health first aid in the community, and the agencies that provide that, which are Atrium, Partners, and Partners pretty much, which is our local management entity. And we added on here the question, persuade, and respond to this, because that is just another program that we could put out in the community, and it's a shorter program than mental health first aid is a day-long program. QPR, which is the question, persuade, and respond, is only a few hours, and it's much less, it's a little less intense, but it does provide that education and information in the community. So our goal was really to have more sessions out there in the community. And then just going back, there are a few to the other programs that are highlighted here is one, our community resiliency model, CREM, which is teaching community resilience. And again, this is just something that, a model that we can do in the entire community. We're not doing it currently, but it's a program that we decided would be a good one to educate our community on and our providers. And then the last thing under mental health right now is to develop a plan to improve the continuum of mental health providers in Union County. And that was something that really came out of a few different groups, that coalitions, that, you know, we have some gaps in the community, and I'm gonna talk a little bit about how these are being addressed. So hold off one second, and I'm gonna get to that. And then under the substance use disorder, you see the results is all residents of Union County have equitable access to education, prevention, treatment, and recovery services related to substance use disorder. And then the different indicators are the drug overdose death rates, the number of opioid ED visits in Union County, and then we also put some of the tobacco information on here, because that's another area that we've been focused on here in our county as well. But there's no local data on those three, unfortunately. So some of the programs that are in here are ones that we're working on, actually using some opioid settlement dollars to do. So currently in the process of developing a family treatment court up in Judge Hucks is working on that with the opioid settlement group. And so that's really exciting, but that won't kick off until sometime next year. We are looking at continuing our naloxone distribution, which we're doing here and other providers are doing out in the community as well. We are working on developing a combined program with the schools, law enforcement, and our behavioral health collaborative. So an initiative, and again, we're still in the talking phases, very early phases, but something that we're working on. And another thing that we have been working on is our tobacco-free ordinance as well. And that is something that Dennis and a few of us here have been working on. So I know that this issue came up last time, but we, the Union County Advisory Coalition really oversees the CHIP. It doesn't mean we're doing everything that's on it. There are community organizations out there that are working on some of the goals. It doesn't mean that we're not working on some of them, but for the most part, the community organizations are doing this. So I think I mentioned that Thrive Union is putting together that housing symposium, and that collaborative meets the third Wednesday of each month from 12 to 1:15. They actually meet in this room. So they're actually putting that together. We have a few groups in the community. One is the System of Care that meets the second Tuesday of each month, and they focus on mental health issues in the community and the different systems that impact them, and this is regarding children. So that's something that Partners helps facilitate in our community. We also are looking at developing a mental health committee to really put together that, to look at those gaps. We did have a group that met together, and it consisted of law enforcement and the hospital system and staff that we have here, and we really looked at some of those gaps in services in the community for children. And so we want to, that group discontinued, but we want to bring a group together to really continue to look at those gaps in services. And then in terms of a substance use committee, we are going to be using, so with the opioid settlement group, we got together a group of substance use providers to really educate and talk about what the needs were in our community around the opioid settlement or opioids. But what we want to do is use that group as a group that's going to look at all the substance use issues in the community. So that's a committee that will boot and start back up probably in another 4 to 6 months or so, but it's something that we'll have out there as well. And that's what I have so far. So if you have any questions, let me know. And again, I'll send the link so you can expand and see what the chip looks like. And I think I've sent out, and I can send out the one from 2019 as well, and you can see all the data on it. And again, I continue to enter the data. So again, I'm responsible for entering it and maintaining it in the system, but our entire community is responsible for overseeing the chip. It's not one, person or one agency that's responsible. I hope that is helpful and clarifies what it is. Questions? Sorry. It's a kid. Sorry.
I have a question on the QPR. I know you said Partners and Atrium has it. When we do QPR, I'm an instructor. Like when we do those, who would we hand in the data? Because we did train 88 in October in Union County for that.
Yeah, actually, they do mental health first aid. I'm not sure everyone who does QPR, so.
Yeah, we do that one too.
Yeah, that's great.
And so, and I did get consent to start tracking our union, for that.
Yeah, and it's basically just numbers more than anything, how many people attended.
Adult and versus kid and stuff, right?
Mhm.
Okay.
Be
Do you
great.
need the demographics too? Nope?
I don't.
Okay. The school law enforcement behavioral health, that's a new initiative coming?
Correct.
So I just recently started serving on the Center for Safer Schools, and so I am representing our area for that,
Great.
for the upcoming school threat assessments.
Okay. Great.
And then Stephanie, I saw that we're tracking the number of people in attendance for the QPR class. I'm wondering if it would be beneficial to track the number of people in attendance for the Behavioral Health Collaborative for the presentations about the social and emotional wellness. Those
I don't know if that's something, Christina, is that something you even track?
Or not really?
Not currently, no.
Yeah.
And honestly, our capacity to do presentations is really limited because we're actively serving kids in crisis every day. And so the kind of prevention aspect of having presentations, generally for students and staff, doesn't happen as often as what would be ideal because of the level of crisis that is the reality of schools every day.
Do y'all have those worked into certain grades, like to where it's aligned with like a health class? All the 7th graders or 9th graders get it proactively to, do you know how they're currently approaching the school mental health initiative and requirements for that, for SEL?
How the school is handling that, I mean, basically when my team gets asked to do a presentation on any given topic, they plan for that and make it happen. It just depends on, when they're asked to present information and to who.
Yeah.
Great question.
I just think it'd be interesting to see, like the number of people in attendance when it's an open, session where parents and students can come,
Yeah.
see what's, effective.
It's something we could definitely look at.
Any other questions or comments for Stephanie?
I do want to mention one other thing. Just because something isn't on here doesn't mean that there are other initiatives that other organizations are doing or that might not be on here. So for example, I'm working real closely with Union County Schools. We actually work to make sure that the tobacco curriculum was modified because they were using one from like 2012. And that it was consistent, and so now they've implemented a evidence-based curriculum in the 6th grade and the 9th grade in all of the classes, and I've trained all of the teachers on how to do that, and we're certainly looking at the substance use side too, but again, just not everything's on here that every agency is doing. It's just what raised to the level of what the the Healthy Union Advisory Coalition thought should be on here. And plus, tracking all of it is pretty daunting if you have too many goals and aspirations on here. They tell you really not to put a whole lot of programs and indicators on here.
Thank you, Stephanie. All right, moving on with the agenda, we are going to the end of the year public health budget summary with Ms. Joyner.
Thank you. Everyone should have received a 2-page budget, which really this is to make you all aware of what the financial picture of public health is in Union County on an annual basis. This is just to make you aware of how we receive money, also how we spend money as it relates to our overall operations. You have the first page is basically looking at the revenues, and the second page has the actual expenses. So for fiscal year 23, which ended in June 30th, we had a budget of actual expenditures of $14 million that cover all of our public health services here in Union County. Roughly 50%, about 51% of the revenue that supports public health in Union County is from local county dollars. That's ad valorem taxes that are coming in to support the public health work that goes on here. You'll see at the top of both pages, it has the total there, and you can see sort of a breakdown of how we generate revenue that offsets some of those costs of services in terms of fees and third-party payers, Medicaid. We received a little over $2 million. We also received what's called the Medicaid cost settlement, which is it's a little hard to explain because it's not every provider in North Carolina receives these funds, this cost settlement funds, but because we are a safety net and the state Medicaid program recognizes that we have to provide some services that may not be getting compensated through just regular Medicaid rates that the state provides for those services. They allow us to file a cost report at the end of every year, and then we are able to then get a cost settlement payment. And it, in the past, has been fairly sizable. This past year, we usually get one payment a year. Last year, it was 1.8 million. The year before last, sometimes we may get two payments, depending on when the cost reports are submitted and when the payments are made. But generally, those funds that come to us help offset our operational cost as well. And it's very beneficial for public health services across North Carolina to have access to those cost settlement funds. One of the things that's beneficial also in Union County is we are allowed to have a Medicaid cost settlement fund balance, which in essence, it's if we project that we're going to receive and use a certain projection of Medicaid cost settlement funds, and when we receive more than that, the county allows us to roll those dollars into a fund balance that can be used and protected for future use for public health related services that is uncommitted at the time, but it allows us, if we have a need, to be able to go to that fund balance, and that's beneficial for the county because then the county doesn't have to necessarily utilize general fund balance for some of those kind of costs or expenses. Typically, we use that for one-time kind of expenses, but that's just a little nuance about the cost settlement funding that we receive. We receive a little over $3 million in state and federal funding. Most of those are in the form of an agreement addenda with the state, and it's a formal process whereby we get certain allocation of funds for different programs that we have, whether that's child health, maternity services, high-risk maternity. We have a whole TB, communicable disease. We'll get anything from a large amount of money, several $100,000, to something that's almost laughable. It costs more money to process the agreement addenda than it is what we're receiving. A few $100s here and there, but it is how we draw down those federal dollars, state dollars. And most of the federal dollars that we receive is pass-through dollars through the state. We don't really receive any direct federal funding without it being a pass-through. I can't think of anything that has happened. 2 years ago, we did get a grant to help support purchase of an electronic health record system for inmate health, but that was sort of a separate grant. So that sort of shows you what our revenue structure looks like. And then it has a breakdown of the different pots of funds Some of the things on the left, the descriptions that you see, are the programs in which those funding sources, how they come into us. You'll see that we still have and are receiving some COVID response funding. For the most part, those dollars are going to be going away this year. For the most part, most of them are going to end at the end of May. We have, I think, one or two that is going to roll into December that we'll have the ability to draw down funds on that. So you'll see on the left-hand side some that speak to a 300 fund. That's just the way we characterize rolling funds that covers multiple years, which is certainly was the case for a lot of the COVID response funding that we received. So I will leave that. If there's questions, I'll certainly try to answer it. This is just to give you a picture of what our operational budget looks like for public health services here in Union County.
Any questions for Dennis? Thank you, Dennis. Next on the agenda is the public health clinical service fee with Jackie Morgan. Oh,
Yeah, I'm gonna
okay.
I'm going to cover that one also. As you all know and have experienced periodically at our meetings, you will see us bringing fees to the board for your approval. The process for fee setting is to present it to the Human Services Board, whereby you then essentially approve their being requested to the county commissioners, who ultimately have the responsibility for setting fees in the county. Typically, we try to align fees with the budget process so that it all gets approved during the budget process, but as there are changes throughout the course of the year, we have to either change or add new fees, and that's one of the cases here. You'll see that the fees presented, most of these are related to COVID vaccine fees. When the federal public health emergency was lifted, there were a lot of changes in terms of how vaccine was being administered, in terms of delivery to local public health. And in essence, it sort of renormalized the process to how anyone would be getting vaccine. We now have to purchase that vaccine, order it, supply it, store it through private vendors. It's no longer funneled to us through the feds and the state, as was the case for really the last 3 years during COVID. So what you see here is essentially the fees that are associated with the various COVID vaccines. We typically, as part of our process, look at what the Medicaid reimbursement rate is for that vaccine, and then we adjust that 30% above that Medicaid rate so that we can possibly capture any commercial reimbursement that may be a little bit above that, but that's typically the process. So you see the fees that are there and what's being recommended for each particular vaccine. Most of this is Moderna and Pfizer, and it does have differentiation based on age categories for the vaccine. There is also an administrative code that is used for the administration of that. We elect to keep that at what the Medicaid rate is. We don't want to add a lot of administrative additional costs on top of that. The other thing that is on here that's not related to vaccine is pregnancy tests. We're looking to adjust that, reducing that fee a little bit. And I'm not totally sure why it was higher than it really probably needed to be, or we were comfortable with. We're reducing that from a $20 charge because the Medicaid rate plus the cost of what a pregnancy test is for us certainly is covered by this recommended $10.45. We also are cognizant of the fact that we want to make sure that folks who need a pregnancy test, this is not a barrier for them to be able to get it so that they can get into care as soon as possible. So these are the fees that we're presenting, would like your approval so that we can take it to the commissioners.
Dennis?
Yes.
If someone is charged the fee, the difference between the Medicaid reimbursement and the fee, are they charged that personally?
If they are, if they're a Medicaid recipient, we can't charge them any more than that. If it's private pay, then it's possible that it could be charged, the difference.
And if they receive neither, they pay the full amount?
Or slide.
Do the full amount.
For private pay?
Because these don't slide, yeah. It would be the full amount.
And that, I guess, is my next question, because it says fee slide, yes or no, and you're saying there is none? They all have yeses.
It shouldn't be. For vaccines, it shouldn't slide.
So those should all be ends?
Right. They should all be ends.
Yeah, that is correct. To make this just a tad bit more complicated, but it is being totally transparent, depending on the program, as Ashley's pointing out to me, if someone's in a family planning program, it's possible that the program will allow the fee to slide. So, like for an adult health, it would not.
Right, like in our STI clinic, if a patient needed a urine pregnancy test, it would just be that cost. Or if someone just came in and said, I want a pregnancy test, it would be that cost. If they're being seen in our family planning clinic, that clinic, those fees do slide. So if they only pay 60% of the bill, they would only be charged 60% of that $10.45.
Not to confuse you, but as a lot of these programs do have their own stipulations on how the fees get applied.
The majority of the people that y'all see, did they fall under Medicaid or commercial or neither? I mean,
Like for the COVID vaccines, is that what you're?
in general,
In
I mean,
general?
yeah, trying to understand the 30%, you know, like who's getting hit by that?
Most people, it would probably be that are insured that are getting that. Like for these COVID vaccines, there is state vaccine for children, there's bridge COVID vaccine for uninsured adults. And so insured adults are the ones that these fees would be for.
Yeah. We do have some avenues for someone who doesn't have insurance and they don't have the ability to pay, like the bridge program, where we can provide that at no cost to the individual. And so we still try to apply that where we can to make it advantageous.
And that's above their percentage? Like if they had insurance that was like 80-20, they would pay this difference plus their 20, or is that where it factors in? How does that work out?
If it was Well, if their insurance their insurance would be billed
It would be commercial.
This amount.
what this amount is, and then if they,
Right,
you know,
so
if
they would
they're-
owe,
they would owe 20% of what their balance is.
right,
That's what I would guess.
Yeah.
That's the highest amount they could charge. And then
Exactly.
if their insurance company paid 80/20, then the insurance company pays 80%.
80% of that, and then the
person pays the
remaining
other
bill
20.
would be that 20%.
and there's no balance for the new recommended fee. That, I guess that's my question, like, take number 2, line 2.
Okay.
You know, the 6538 for commercial insurance and versus the fee of 77.
So if it's commercial, they can't go back to that 77. They have to go with what
Gotcha.
is accepted in the commercial rate.
Right.
you. Okay, thank you.
So I would ask for approval that we carry this forward.
I'll make a motion.
I'll second. All those in favor, let me know by saying aye.
Aye.
All those opposed? And then for tonight, we didn't have anyone registered for public comments, but if you'd like to go around the table for any announcements.
Good evening. I just wanted to, first of all, thank you all for being here, and for taking the time to listen and contribute every month. I know some months are more exciting than others and some less exciting, but your time is very much appreciated. I also want to remind you that in the spirit of your time being appreciated, we do not have a meeting in the month of December. So we will not be seeing you guys again until January the 8th. And I believe that in that first meeting, Carla, we will be electing the chair and vice chair positions. So if you or any of your fellow servants have any interest in that, please talk amongst yourselves and think about that maybe before January in terms of your willingness to serve, because Megan cannot serve twice. So that's the way that goes. Although you've done a fabulous job. And I think similarly, we may have a member who will be rotating off of the board, which is always a bummer, because we do have one of the bylaw rules is that no member may serve more than 2 consecutive 4-year terms. And so, Missy, I think you may be rolling off, so January may be your last meeting, that's correct? So if you all know anyone that would be an excellent, amazing registered nurse, hopefully, Missy, you might have some people in mind also, but please let them know that we will be having a vacancy coming up and to put in an application because, well, we appreciate your input and need it. So, and other than that, I don't have any other announcements. We're getting ready to kick off budget season, which is always exciting, so we'll probably have some information for you in January or February on that. And I think the only other thing I should probably mention is that the Warbirds over Monroe event went well, did not get rained out, which was a blessing. Michelle Marcano was not able to be here tonight, but they had a very good opening ceremony and were able to move that underneath the covered tent. So that worked out well, which again was a blessing, and it's a good partnership with the city of Monroe. And several of our board members were able to be there as well to present awards to the JROTC recipients. So if you were able to go, hope you had a good time.
Hi, I'm Christina Neal, the program manager for the Behavioral Health Collaborative. Obviously not Ashley, but standing in for her tonight because she has a sick child, so I do have her updates. And she wanted to let you all know that Medicaid expansion is set to start on December 1st. We have got a lot of great applications from the county's career fair a couple of weeks ago, so we're hoping to have additional staff on board to help us with rolling that out. Also, we are hiring social work positions, eligibility specialists, and also in our behavioral health collaborative, we have a therapist position that is open. That's what I have. Thank you.
Okay, I have a few more things. Christmas Bureau, we moved into a new building to put together all the items, and we're gonna be distributing out of this building. If you would like to volunteer, you can go onto our website and follow directions on the website. And I believe it's contacting John, our volunteer coordinator. I think that's what you need to do, but we're always looking for volunteers, so please, if you can, that would be great. And also, great news is that we are moving our senior meal site from the Monroe Housing Authority, where we've had it for a long time, and they've been a great partner, but we're moving into the new senior center, the Bracemore Senior Center, so we're going to be starting that sometime in December. We're really excited because it'll give our seniors an opportunity to participate in the programming over there. And so it's a win-win. That's it.
Two things I wanted to mention. One, and actually Dr. Broadway or Ashley may want to comment on this, but one of the things that we've had the good fortune to have some additional funding this year to allow us to do some pre-exposure prophylaxis for human rabies for at-risk individuals in the community who could be potentially exposed. As many of you know, rabies is an expensive proposition once you have been exposed in terms of getting post-exposure rabies prophylaxis. And so we were able this year to utilize some funds to assist in making sure that individuals throughout the county, we did this in several phases. The first phase was sort of reaching out to rescue group individuals, folks who work with animal populations on a regular basis to avail themselves to, if they were interested in getting this pre-exposure vaccine, and had a good turnout for that. That was done back in the fall, and then more recently, well actually that was done more in the summer.
It was actually fall.
Okay.
Yeah. We were gonna do this second one earlier, but it got moved.
Yeah. And then the most recent one was staff kind of went on a round robin tour across the county with Dr. Broadway to various vet clinics across the county to provide that for individuals in those clinics who may not have had vaccination. This is pretty unique. This is not something we're going to be able to do every year, but I think it was a great opportunity to give back into the community, and particularly a segment of the population that may not wonder how they may benefit from public health services. We were able to leverage that, and I think a lot of veterinary practices were very appreciative of us being able to provide that level of prevention frontline for folks who are at risk for potential exposure. So I want to thank our communicable disease staff and Dr. Broadway for putting that together. It took a lot of work to get schedules all lined up and to make that happen. But it's been, I think, a very good success. So I want to thank folks on that. The other thing I wanted to mention, and I think I missed the last meeting, so I'm not sure if this was brought up. Has there been discussion about the inmate health transition? Yeah. Several months ago, we made a decision to transition out of providing inmate health services as a health department program and function. A lot of this was based on the fact that we're the only county remaining health department in North Carolina that is providing inmate health services. Most of the counties across North Carolina, the jails contract for correctional health services through some vendor. There's a number of them out there that does that. I think we've done an excellent job. We've got great staff that have made it very successful, and but the challenge of continuing it with a lot of the recruiting difficulties and challenges, that it was sort of its own set of challenges. Inmate health is a difficult service in and of itself. Recruitment is challenging. Having the appropriate bandwidth to be able to cover 24/7 operation was becoming more and more challenging for us, and so I felt that it was in the best interest to look at transitioning that program. So that has started, and county administration was brought on board, and we're in the process right now, and ultimately this is a responsibility of the sheriff's office statutorily to provide inmate health services. They're going through a process right now for an RFP that's now open, and we'll be seeing what the vendors are that come in, and we'll be looking at transitioning that program throughout the remainder of this fiscal year. We have made efforts to try to provide some retention package for staff that we have available, that are our inmate health staff that are currently on board, to hopefully that they will continue for a while. And we're also looking at opportunities where we have positions, if folks are interested and that's a good fit for them, where we will give high consideration of transitioning staff over time as this transition occurs. But I wanted to make y'all aware that this was taking place, and it's going to take a little while for it to all get finalized. But it's sort of a bittersweet kind of thing. But from a business perspective, just felt that it was in our best interest from a long-term perspective to make this transition now. So it was kind of tough being the only health department in the state that you don't have colleagues, there's no other guidance, there's no folks to discuss the issue. I mean, you can discuss it, but it's just not sort of the same. So that is the process we're in, and I want to make sure y'all were aware of that.
One other thing. So we have brought to you several times the smoking ordinance, and that is slated for the November 20th Board of County Commissioners agenda, and so they'll be receiving very brief information just about the fact that we have the requirement federally to have a smoke-free campus as a provider of services for Medicaid, and we would anticipate, or our request for them is to begin to implement that transition within the county for just this campus, to change the ordinance for just the Human Services campus, and to begin to implement that in the February timeframe so that we can be ready to go for the April 1st deadline that is the threshold that Medicaid has established. And so I just wanted to also let you know that is moving forward.
Any other announcements or comments? Or is there a motion to adjourn?
I'll motion.
I'll second it. All those in favor, let me know by saying aye.
Aye.
Have a good night.